Singapore's Ministry of Health says the tighter coordination among government systems established during COVID bolstered the response to outbreaks like tuberculosis and mpox this year. It stresses that lessons learned, such as agility in resource allocation, will be crucial for future pandemic preparedness. Sabrina Ng examines how these insights are shaping Singapore's strategy for future health crises.
Empty airports and quiet markets. It was as if life came to a standstill during the height of the COVID-19 outbreak in 2020. But today, the pandemic has seemingly faded into the background as crowds and gatherings return in full swing. Still, it's difficult to predict how future outbreaks will transmit and spread, and so staying ready is key.
If we look at, for example, experience in COVID-19 and also our earlier experience in the original SARS coronavirus 1 in 2003, both of them are coronaviruses, but their spread, their presentation and the response measures are vastly different. Therefore, it is important for us to have a preparedness response system that is flexible and nimble enough to deal with a future disease X. X referring to a future known or unknown disease that can present in whichever different way.
Prof. Lee says one key takeaway from COVID is the need to coordinate across different systems within the government and society at large. This came into play earlier in the year when a cluster of tuberculosis cases were uncovered at Jalan Bukit Merah.
This open-air car park may be empty now, but this was a site where over 2,500 people were screened for tuberculosis. A temporary tent was set up here in January after 10 cases of TB was detected in the Jalan Bukit Merah area. And this effort to isolate and detect these infectious diseases quickly is a key part of Singapore's pandemic strategy.
Authorities also use systems developed during COVID, such as registration platforms, to deliver test results and follow-up notices to residents. They also learned that consistent and swift communication was key to ease concerns in the event of a disease outbreak and to prevent misinformation from taking root.
To do this, we actually went on a door-to-door exercise, something we also did during COVID, to really communicate all about TB and what they need to do to every single resident. And we also work with the grassroots organizations to reach out to residents who, for example, were not at home and were not easy for us to reach out to.
The COVID-19 pandemic also showed the government the need to strengthen healthcare capacity. Mr. Lee adds that MOH is working to ensure that the healthcare system can meet demands during peacetime, but adapt to respond to pandemic outbreaks if needed. That includes keeping isolation and quarantine facilities warm and strengthening Singapore's supply chain resilience for critical goods like vaccines. Ensuring that healthcare workers are well prepared for the future is also crucial.
We need good systems to share frontline information when cases surge in an outbreak. We need resources to care for patients, testing, treating, admitting patients, making sure we get them home safely. And NCID is working to refresh these workflows in advance of the next outbreak.
So while memories of social distancing may be a thing of the past, lessons learned have burned themselves into the hearts and minds of Singaporeans. Authorities reassure that systems are in place so that when the next pandemic comes, Singapore will be able to adapt and save the lives and livelihoods of its people.
From border control to mask wearing, Singapore continues to keep the features of several pandemic response measures since the outbreak of COVID-19. Sabrina takes us through some of the ways the nation is gearing up against the next outbreak.
On border control, all travellers coming into Singapore by land or sea must submit a health declaration through an online arrival card service. This is a step down from the height of COVID, when all travellers coming into Singapore had to show proof of a negative pre-departure COVID test. And while you don't have to mask up on the public transport or in indoor healthcare facilities since February last year, it's still a requirement for higher risk medical settings such as emergency departments. The Health Ministry says this is to improve general infection control practices and ensure that medically vulnerable persons and seniors are well protected. Singapore has continued to roll out updated COVID-19 vaccines even as it closes down joint testing and vaccination centres across the island. COVID-19 jabs remain free under the National Vaccination Programme and available at nearly 500 GPs and 10 polyclinics.